Miss Pons. Miss Pons, wait a minute.
I need to go to the bathroom. I need to go to the bathroom.
I know you need to go to the bathroom, but remember, you're in the hospital.
No, I think I'm at my daughter's house.
No, you're not at your daughter's house. You're at the hospital, and we want you to use your walker whenever you're out of bed.
Okay.
And do you remember what else we want you to do?
Call the fire department.
Well, not the fire department. We want you to call the nurse's desk so we can walk with you when you need to go to the bathroom. Are you ready to go now?
I am.
Okay, now is your body in the frame of your walker?
Oh.
And do you have grips on your socks so you don't slide?
Nope.
Then we need to get a pair of shoes for you. Can you sit back down in your bed? Good. Okay, I'm going to grab your shoes. Do you promise you'll stay right there?
Yes.
Okay. How we doing here, Mr. Jones?
Okay.
Okay.
Yeah.
All right, let's have you rest right there. Let me get you a chair. All right, I'm going to have you sit down. You're not kind of breathing heavy. Let's sit down over there. All right, there you go. Got it? All right, feeling okay? Breathing pretty heavy. Let's check you out here. All right, so give me a finger. Go. All right, it's looking like you're a little low and your heart rate's pretty high here. So let's take a rest because we don't want you breathing that heavy. You got to get your oxygen back up and your heart slowed down a little bit.
Etsy, good morning. How are you doing?
All right.
All right. Would a shower make you feel better by chance?
It would be really nice if I could get a shower.
Oh, great. Well, let's do that this morning.
Do you know I haven't showered for 6 days? 6 days.
Well, then we better take care of that.
Okay.
So before we move anywhere, do you remember your precautions?
No lifting more than 5 pounds. No pushing or pulling.
Yeah. So how are you going to get up without doing those things?
I don't know.
Have you gotten up yet?
Well, they always usually pick me up.
They pick you up?
Yeah. Those big CNA guys.
So you just need to take some of them home with you.
Yeah. If I could get the hot one, that'd be good.
All right, I'll have the doctor write that into your prescription.
Okay, do you know where your bathroom is?
Yep.
Okay, here we go. Remember, we walk inside of our walker. We do not push it in front of us. Good job keeping your walker with you. Now turn with the walker, bring it with you. Good job. Now back up to the toilet. Very nice job. Now I'm just going to stand right here while you use the restroom.
Like, I really like to go alone, like some privacy.
I understand, but when you're in the hospital, we have to stay where we can see you so that you can stay safe.
Could we wait outside the door, honey?
I'll stay right here. Been on oxygen before, Mr. Jones?
No.
This is your first time?
Yeah.
Yeah. How's it going for you? Has it been?
Oh, it's okay. As far as doing things around the garage, cooking, things like that. It gets a little tiring.
Mm-hmm. Yeah, getting tired real easy.
Yeah.
Okay, so like we did here, we're gonna want to keep somewhere you can sit real easy nearby. Okay, so you're not putting yourself in danger of falling because you're getting too tired. Okay. Well, we'll just keep resting here for a while.
So first, why don't you bring your legs across and over off the bed. Great. Now remember, you don't want to push with that arm. Let's see if you can use those muscles to get up. Good. Take a couple breaths. How do you feel?
All right, I want to shower.
We're getting there.
Okay.
It's our goal. It's our destination.
All right.
So before we go anywhere, I just want to check to make sure you're getting enough oxygen so that we can make sure you can walk on your own there.
Okay.
All right. So just relax. Excellent and relaxing. Think of a beach. Think of the hot CNA. I might have him get some stuff out of the supply closet with me later today.
He's a young whippersnapper, he is.
Yeah. Oh, it works. All right.
97.
97.
Pulse is 79. That's not bad.
All right. Great. So the next thing is we're going to stand up and go to the walker. But remember, you have these things attached to you.
Oh.
So we want to take our time. We don't want to leave him behind.
Yeah, I want to take my Pete with me.
That's what the cool kids are doing.
Remember, you need me with you whenever you're walking around in the hospital, okay?
Keep me on a leash.
Well, we do a short leash as well. Miss Pond, stop for just a minute. Is there anything you need to do before you go back to bed?
No, I did my business.
Okay, what about at the sink? Hygiene. Let's walk over to the sink. That's much better. Look, your heart rate's down and your oxygen's much better. We like that. All right. Okay, Mr. Jones. Are you ready?
When you stand up, you want to use your leg muscles and not your arms and not the walker.
Okay.
So you're going to want to come forward a little bit and use those legs to get up.
Okay.
So let's wait just a moment. Let me get myself into position so I can help you out.
Oh, should I have oxygen in my face too?
I don't know. Should you? Your O2 is really good.
Oh, okay, that's why they
So
don't have the oxygen
remember,
on me.
we're not pulling on this and we're not pushing off the seat. Which is, why don't we just cross those in your lap? Can you cross your hands in your lap right here? And then when you're going to stand up, you'll scooch to the edge of the bed, and then don't get up, just watch me. Forward and up, and then you can rest your hands here. You ready? Very nice.
My legs are strong. Like ox.
Strong like ox.
Like ox. Like that CNA guy.
Reach behind you for the bed. All the way back. I'm going to move the walker, and let's see you get all the way back into the bed. Look out, Miss Pons. You don't want to go over the edge. How about just this blanket?
Can I sleep in my shoes too? I like to sleep in my shoes.
Well, maybe we should take them off.
Just keep them tidy. Keep them tidy.
Okay, I'll deal with that in a minute. Okay, can I get you anything else?
I think I'm good, honey.
Okay, and what do you do before you get out of bed?
Call the nurses.
Okay, and how do you call the nurses?
With my loud voice.
With your loud voice, or what else can you use?
I don't know.
Remember your call light button. It's on the side of your bed. Show me the button you push.
Oh, this.
Yes. Show me the button you push so I know.
Right here.
Good job. Okay, you sure you don't need anything?
I'm good.
Okay, I'll be back when you need something. Good job. All right, we're going to check you one more time, see how you're doing with activity. All right, here we go. One last time. All right, so when you're active, it definitely it's harder to breathe, and you can tell looking at this that you're having more trouble. All right, so what are some things we can do to make sure you're not overworking and keeping your lungs in okay shape?
Well, I think taking my time,
Mm-hmm.
like I said. I have a lot of things like an overhead shelves. So I suppose just making sure that those are within reach.
Yeah, exactly. So the reaching and the activity is definitely going to make you more tired and going to hurt your lungs a little bit more, okay? So that's definitely good strategies, thinking of bringing things closer to you. Do you know, have you been using oxygen in the shower?
No.
Okay, so that's a really tiring place. So we're going to make sure when you're in the shower you're using oxygen, okay? Okay, we don't want you getting hurt in the shower. That's probably the worst place to have it happen, so we don't want that.
Oh, great. That nurse did a great job. I don't think any water's getting in this.
Well, that's good.
Yeah, we don't need any infections or anything, so we'll keep the water out. Keep an eye on it. If you find there's any water getting in there, let me know.
Okay.
So, Mr. Jones, how'd you feel about therapy today? Are you feeling like you learned some things?
I guess so.
Okay.
Feeling tired.
Yeah, it definitely wears you out.
Yeah.
Do you have any other questions about your oxygen, since this is new to you and you're gonna go home with it?
How do I know when I'm getting enough oxygen
Yeah.
flow?
Right, so when are you getting enough? So something that I've noticed for you while we've been walking around is you've been breathing a lot heavier. Can you tell that when you're starting to not have enough oxygen, you're breathing really heavy and you're trying really hard to get that oxygen in? So when you start noticing that you're trying so hard to get oxygen in, then that's when you're gonna need to slow down and stop. And if you're having a lot of trouble, then we'll talk to the doctor about changing your levels of oxygen to make sure you're getting enough. But that's something we'd want to talk to the doctors about how much you can be on and kind of what to do during those times. We want to make sure you're getting the right care that way.
So let's get into the shower. But remember, you don't want to use those arms beyond the restrictions.
Okay.
Great job.
Miss Pons, what are you doing?
Oh, I need to go turn in my homework. Turn in my homework.
No, ma'am, you do not need to turn in your homework today. You have to stay in bed unless someone is with you.
Oh, I use my loud voice, but don't think.
I did not hear your voice. What did I ask you that you needed to do before you got out of bed? What was your other option? Remember your call light where you push the red button? Let's get you back in bed. And that's what you push if you need to go anywhere.
Hospital beds are like desks, I swear.
I know.
Just like desks.
They're about as cozy as a gravel yard. Okay, can I get you?
Will you turn in my homework for me?
I'll turn in
On
your
the
homework.
COA. Turn in the COA.
I will turn in your COA for you. Is there anything else you need me to do for you?
I think I'm good now.
Okay, what are you gonna do before you get out of bed?
I'll use my loud voice.
Not your loud voice. What do you use?
This magical button.
The magic button. Hit the magic button and I will magically appear, okay? Okay.
Remember, don't use those hands. You can do it. Okay, good catch. Good catch. All right.
Okay. I'm fine. It was
You're
just
fine?
it was just I was thinking about the CNA.
Oh, disaster averted. All right, let's go find him.
Okay.
Oh, wait.
Something's yanking. Oh.
One last thing. You can't go see this hot CNA without your pee bag.
I wanted to see my urine to see that I'm well hydrated.
So she's a huge liability if she falls. And I'm advocating for either a one-on-one aide in her room to monitor her or a bed alarm.
Yeah.
What do you think would be most appropriate?
Well, that makes a lot of sense. One thing I'd be curious about, have you noticed if there's any clues as to what she thinks she's getting up to go and do? Is there particular activities that are drawing her out of bed?
Not really. It seems to be just confusion. One time she indicated she needed to turn in a homework assignment. One time she was looking for someone. It just seems to be general confusion.
Okay. Well, yeah, I certainly would support either a bed alarm or the one-on-one, but what I'd like to maybe do in addition is, I think I'd do the Ellen cognitive level and see if we couldn't just get a baseline for her cognitive functioning.
Okay.
And then I also think I want to check in with the family just to get a sense of what her typical routines are with up, sleep, and up, even if it is at the dementia care unit, or maybe I need to talk to them first too, or in addition to. So we can maybe get a sense of if there are activities that she's interested in, we can get her up and engaged so she's not just getting up randomly. What would you think about that in addition to the alarm?
Yeah, her family does come in usually in the evenings, so if you're here after 4:30, you could probably catch them then.
Aren't we? Let's fix that. All right, let's get around. Here you go, Mr. Jones, why don't you?
So,
Okay.
could you give me an update?
Well, sure. Mrs. Pons has been on the floor for a few days now, and she is not
On
staying
the
in
floor?
bed. Not literally on
Okay.
the floor. We're on the neuro floor for.
So I don't remember how you would get up.
No, I got take
Typical day. What's a typical day? Oh, ow! Oh, God.
another hit me.
I mean, routines, habits. Talk to me about your habits.
All right, good.
I got distracted thinking about the hot CNA. Back to showering.